Hello, everyone. Hi, CFC community. Welcome back to another session. I hope you guys are doing super well and you're having a great week. And I hope you've had a chance to catch up on the previous video, which was on the health belief model. So before we dive into today's topic, let me just pause for a second and introduce myself because I realize that I might be a new face for you guys. So my name is Ipsita. I also go by Ips, which is usually easier for people to pronounce. And I'm a behavioral scientist at Common Thread. If you guys have any questions at all, by the way, based on the previous video or on today's video, or any at all in general while you're going through this course, then I would really want to encourage you guys to use the WhatsApp group. Hopefully you're all on it. If you're watching this and you're like, what WhatsApp group? Let us know, we'll add you in. Hopefully that's not the case for anyone. But yes, I just wanted to take a second to encourage you guys to really use that community to ask questions, to share your ideas. Maybe you're watching these videos and lots of ideas are coming to you and you're getting excited about how you can apply these learnings. So do take it to the community and share them with us. Ask questions, we'll be more than happy to answer. And yeah, let's get straight into today's topic, which is another behavioral framework. It takes a few steps ahead when compared to the health belief model, and we'll talk about why and how. But basically, the health belief model, as a reminder, was about an individual only in isolation, whereas the socio-ecological model layers the individual into various social settings that they are a part of and looks at more of a holistic picture. So let's get into it. Now, I like to think of this as an onion, right? An onion has various layers. This specific model has 5 layers. The individual sits as the core of the layer of the onion. And on top of that, you kind of build on one by one the rest of the 4 levels. So essentially, it does in a way cover the HBM, the health belief model, because that is zooming straight into the individual, right? Now, when we think about an individual, we mean their demographic sort of variables such as age, gender, income level, sexual orientation, and stuff like that, which is all about the individual. It also encompasses a variety of psychological factors such as their knowledge level, their skills, their behaviors, their thoughts, their feelings, their actions, right? So that's kind of a deep dive into what an individual looks like, where they come from, what their thought processes are, and that then we can kind of think about what interventions would target their behavior best, right? Now, the socio-ecological model builds on that. It doesn't just look at an individual in isolation. It also thinks about these other layers. So let's go through them one by one, right? The next layer is interpersonal. So this you can think about as in essence as like an individual plus their close relations, right? It could be their brother, sister, father, mother, aunt, uncle, domestic help, school teacher, students, neighbors, friends, etc. You get the gist. But essentially the interpersonal relations that they have in their life and the interpersonal contact that they have with other people who also influence their behavior. Right? A lot of times, I'm sure you guys can relate, something your mother said when you were young really affected you and has really guided your behavior. And the same thing can be said of an influential teacher or some peer pressure you maybe went through, whether positive or negative, right? Now, the next layer on top of that is organizational. And you can sort of think about this as an extension of this individual. Now, what sort of organizations are they interacting with? Are they a doctor? In which case they're probably going to a hospital or a health clinic every day? Are they a teacher? In which case they're going to a school every day? Are they a stay-at-home wife or husband? In which case their organization is kind of restricted to their home, and so on and so forth, right? So these are the social institutions around individuals that also have an impact on their behavior. Taking it a step forward, the third layer of this onion is community. And I guess the best way to think about community is a set of individuals, a set of organizations all coming together, right? So in any local community, let's just think about the ones we live in. There will be multiple households. There might be apartment buildings. There might be schools and health clinics and hospitals and yoga centers or gyms, There might be religious centers like mosques and churches and temples, right? So that's kind of the community level where a lot of these individuals and organizations sit, and most of them have interpersonal relationships with each other, right? So as a community, there can be social norms, there can be culture, there can be these discussions that the community is going on around having that impacts this individual as well, and obviously impacts each other. The last sort of layer of this model is policy, or the enabling environment. So the best way, I guess, to perceive this is think about the laws and regulations, the constitution, the human rights, the policies and the bills and the legislations that pass in that county, that state, that country then, right? What are sort of the policy variables affecting this behavior as well? And obviously you can break that down into community and organization as well. So various organizations will have their own culture and their own policies. Same with communities, right? Religion can dictate the policy, can dictate the law in a way which can really trickle down and have an impact on this individual again. So the distinction primarily between the health belief model and the socio-ecological model is that this model, SEM, is looking at individual behavior through a variety of contexts, right? You're almost putting on different lenses. Like imagine putting on different sunglasses, right? This is my interpersonal glass. This is my organizational glass. This is my community lens glass. This is my policy lens glass. When you're thinking about human behavior, because it can be really beneficial to take this approach because it gives you a realistic picture, right? We live in a complicated world. So one, I guess, drawback, and some might say, of this model is that it can make it difficult to apply the findings because there are just so many variables to consider. But on the plus side, that is exactly what's making it realistic. And that's exactly what's making it localized in a way as well, if you're using it the right way. And if you're really thinking about the local community, the local organization, the sort of culture that affects these individuals, that really brings out richer insights than if you were to consider the individual in isolation, right? Now, as always, we have a video that we can watch together. Of course, if you guys prefer watching it on your own, you can always click the link and just go ahead and do that. But for the purpose of shared learning, let's just take a second. I'm going to pause share on this screen and I'm going to share the video and we can watch it together.
The social ecological model. What is it? Well, it serves many functions. The social ecological model is a theory-based structure used to determine and identify behaviors for health promotion. The multiple levels of factors, which include individual, interpersonal, institutional, community, and policy, allow us to understand why individuals participate in the behaviors that they do. Whether it be to prevent violence, promote healthy choices, or further understand a decision made by a person, the social ecological model can assist. Now that we have a basic understanding of the social ecological model, let's take a closer look at each of the levels within. The first level is the individual stage. In this level, the biological and personal history of a person is considered. Age, education, and income are some examples of what may fall into this level. Along with these, more abstract concepts such as attitudes, beliefs, knowledge, and skills are included. Think of this stage as a single person and the traits that make them who they are. The interpersonal stage is the second level. Relationships and their effect on an individual's behavior contribute to this level. Peers, partners, business partners, family, friends, and more should all be considered when analyzing the interpersonal stage. To continue the analogy that was previously mentioned, think of this stage as that person previously mentioned, but with their significant other. The institutional level is the third of the five. Here, the organizations, establishments, and foundations in which individuals interact with are examined. The two most notable of these institutions include a person's workplace and/or their schooling system. To better understand this, picture the same individual and partner you thought of before, but this time at their occupation, as a doctor in a hospital, perhaps. The fourth level is the community stage. This goes one step further than institutional in that multiple institutions can be found within a single community. The setting in which social relationships occur beyond that of an institution falls in this level. Examples include a neighborhood or a city. Again, continuing with the analogy, imagine the individual is working within the hospital, but now they're interacting with patients from all over the city of Cleveland, Ohio. Policy is the final of the 5 stages. Policy encompasses all levels below. The difference between it and the others is that policy acts on a much larger scale. Laws, whether federal or state, regulations, and the Constitution are a part of this stage in the model. Because the hospital previously mentioned is in Cleveland, it must abide by all regulations set by Ohio, otherwise consequences will undoubtedly occur. So, what have we learned? First, we learned what a social ecological model is. This model is a theory-based structure used to determine and identify behaviors. Then, we looked at the 5 stages within. The first, individual, considers biology, personal history, and attitudes. Second, the interpersonal stage. Relationships, including friends, family, and peers, are all included within here. Institution is the next level. Organizations, most notably schools and workplaces, in which individuals interact, are examined in this stage. Next is the community. The setting in which social relationships occur, beyond that of an institution, fall here. The last stage is policy. This level considers the largest variety of components, including laws, regulations, and the Constitution. Now that you are aware of the social ecological model and what it consists of, in what ways can you make a difference?
Okay, so hopefully that video explained the model a little bit more. Once again, if you have any questions, just drop them in the WhatsApp channel and we'll get back to you. So let's take this a step forward and remind ourselves of this character, this profile called John. I'm sure you all remember from the previous video, but if not, then take a second to pause and just read this background description again. And now let's have a think about how this new model that we're talking about today, the socio-ecological model, how it impacts and how we can consider it in this context of our character, John. So just a quick reminder, we are talking about the peak of the COVID-19 outbreak in Kenya, where a lockdown was imposed in several counties, and it made it quite difficult for John and people like John to travel to immunization centers, right? He has 4 children and he has to think about the full immunization schedule of these kids and how he's gonna get them to receive these vaccines. He probably also needs convenient access to vaccination, especially in this context that we're considering where because of the lockdown, it's hard for them to go to these immunization centers for vaccination. Also, there was an additional layer here, which is that during COVID-19, the peak, the health facilities were strained, right? There were so many patients kind of seeking help for COVID-19 that the private and public hospitals kind of became closed for outpatient needs. So newborns typically would receive immunizations there that got closed. So that's a big challenge that we need to consider in this example. Just quickly covering the rest of these immunization needs here. He needs vaccinators and mobilizers that he can trust. So some sort of trust in the health facility and health workers. And other than that, he also probably needs access to other health services, right? That meet his immediate needs, obviously. So let's now apply the socio-ecological model to this context of John. Okay, so the first core level, the individual. We say, John does not know what to believe. He thinks vaccines are good, but does not feel that strongly toward them, right? He's worried about his son, who has recently fallen ill, okay? Now let's add on the next layer, interpersonal. And as an example, let's think about John's wife, right? His closest interpersonal contact happens with his wife. Now she is worried about their son because he's fallen ill. But she's unsure whether COVID-19 is more dangerous or whether him not getting his routine vaccinations and immunizations is more dangerous. But she still thinks that they definitely need to find a health worker who can administer their son's vaccines. So she's a little pro-vaccine, okay? We've got a little bubble here saying that you've probably noticed that the HBM, the health belief model, stops at the individual level. At the interpersonal level, we're already starting to discover new information about the context, i.e. his wife's needs and feelings and thoughts, right? That directly might influence his decision to get his child vaccinated or not. So already you're seeing that the SEM is adding on more layers and making it a bit more realistic in terms of the world we live in, right? Let's take it a step forward. So now we have organizational level. So health facilities are extremely far from John's village. And unfortunately, we are in a lockdown, right? So transportation has been cut down. Uh-oh, that's a challenge. Yeah. Let's think about the community now. It says, religious leaders in John's community claim that vaccines are a conspiracy. In a nearby community, health workers are delivering measles vaccines from house to house. So there's a little bit of a mixed context here, right? While religious leaders are saying that, vaccines are a conspiracy, you're also seeing that in your nearby communities, health workers are coming in and they're delivering measles vaccines to other children who are just like yours at household level. So think about what that would do. Now, finally, there's a policy layer. And here we say the government supports vaccinations under the expanded program on immunization by providing all citizens with free vaccines, right? However, most outpatient facilities have been closed. So here we're seeing that the government actually really supports immunization and it's gone ahead and provided all citizens with free vaccines. But we need to think about how are people going to access these facilities where they can get the free vaccines. So let's now think about this question, right? Everyone take 2 minutes and see which one of A, B, C, D you think is likely to happen. Based on the socio-ecological model, how likely do you think John will be to vaccinate his child? Not very likely, somewhat likely, likely, or very likely. And I can just pause here for a second. Think about the reasons as well, right? Why would he be whatever your answer is? And if you have a pen and paper, maybe you can write down why as well. These are the layers affecting him. Okay. So we think that based on this model, John is actually likely to vaccinate his child. And here are some reasons why. Okay. So when using the socio-ecological model, we're seeing that most of the factors are actually in favor of John's child getting vaccinated, right? You're seeing that he has autonomy as an independent decision maker. His wife is actually supporting the idea of their child getting vaccinated. And the fact that vaccinations are free are a huge economic incentive as well. Okay. There are some factors, however, that are against vaccination. So these would be the conspiracy theories from religious leaders and the difficulties in accessing this vaccine during the lockdown. So you can see that this model is a little different from the HBM. And obviously the interventions that you design using just an individual level lens versus putting on all these sunglasses we were talking about, they might be different, right? Because you're going through so much more effort and research and work to consider all of these different layers that are impacting our individual John. So lastly, let's think about what type of intervention you might now employ to encourage John to say, all right, let's go and vaccinate our son. So just as 2 examples here, we have to combat misinformation about vaccinations as a conspiracy, you could try and build a relationship with local community leaders and local religious leaders, right? If you're able to do so successfully, John might decide to travel maybe even to a faraway outpatient facility because he might view that as a norm. He might view that as acceptable behavior. He might see, okay, people in general, community leaders, either religious ones that you've managed to convert or other community leaders like politicians or actors or singers or doctors or whatever, local influencers, perceive this as the right thing to do. And that might influence John to be like, okay, doesn't matter if I have to travel a long distance, I'll go and do it because this could save my son's life. And yeah, we have here that this might be the same intervention that you actually deployed using the health belief model, which is pretty cool to come to a similar result. And as always, just as a side note, guys, think about the evidence as well. Whenever you're looking to design interventions, really go specific into the local culture, right? So if we're thinking about Kenya, what have other researchers done in the past to encourage parents to get their children vaccinated? What has worked and what hasn't worked? And don't just blindly apply a study that was done in the West to Kenya, because the context could be completely different, right? But it's interesting that sometimes you might actually end up reaching the same intervention, even using the two models. But yes, obviously it would make a little bit more sense to think about the various layers rather than just the individual in isolation, because they don't live all alone, they live in a wider context. So next point, to reinforce John and his wife's belief that their son still needs to be protected from vaccine preventable diseases, a mass communication strategy could be deployed to educate families about the importance of vaccines during the pandemic and the nearest place to access them, given changes in transportation accessibility. This is really cool because when you do a mass communication strategy, right, you can talk about different features and really weigh out what are the key things you really need to drive home. What are the key points? And here we've got these two, right? The importance of vaccines. So let's go back for a second and consider what his wife said. Now she was worried about her son, but she was unsure. Is COVID-19 a greater risk than not getting my child vaccinated? And that's something that can be easily tackled through this communication strategy, because if you drive home the belief that, yes, vaccines and getting your children vaccinated on time, on schedule is extremely important for their health, then you might appease them of that concern, and you might make them a little more sure of their decision to go ahead and travel and get their child vaccinated, right? And the next point here about really driving home, how do they get there? What is the nearest facility, right? These are transportation issues. They don't know, maybe there's a knowledge gap there, and you are making it clearer to them what facilities exist and how they can access them. And that can influence John to bring his son to an outpatient center, right? As we said earlier, these are just a couple of ideas to tackle the points that we discussed. And of course, you guys might have a lot more ideas and you might have better ideas. So think about how you would probably tackle this situation. And if you're feeling brave and if you want to engage with the community we've got on WhatsApp, once again, put your ideas down in there and maybe we can have a nice, healthy discussion on what the SEM model is and how it applies to John. Maybe even take it a step forward and think about how does it apply to the CFC work that you're doing. And once again, if you have any concerns, just pop them in there as well, and we'll be happy to answer. So that's all for today. I hope this made sense, and I look forward to seeing you in the next one. Bye-bye.